So implantable cardiac defibrillators, or ICDs, are fitted because they can potentially save lives. So if you're at risk of your heart developing a dangerous rhythm, which might cause you to collapse or even die, then the ICD detects that change in the rhythm and it will deliver a shock to the heart muscle. So it kind of stuns the heart muscle for a moment and it allows the heart to go back into a normal rhythm. And we know that ICDs can reduce the risk of sudden death. But of course, ICDs don't make somebody live forever. And if you have an ICD fitted, but you maybe also have another serious medical condition, so that might be something totally separate like cancer, or it might be heart failure that's getting worse, or kidney failure, it may be that you get to a point where actually the risk of you dying from that underlying condition, from your cancer or your heart failure, is greater than the risk of a sudden change in your rhythm of your heart. And when that happens, sometimes a doctor or a nurse might start to talk to you about turning off the ICD. And to be honest, people find that a very kind of confusing conversation because they've had this ICD fitted as a potentially life-saving thing, and so they feel it's a very important thing to keep going. And even if the risk is very small of having a problem with the heart suddenly, why would you turn off the ICD? Why not just keep going with it? Unfortunately, what we know is that when people are dying from something totally different, cancer or heart failure or something like that, it can be the case that the heart does develop changes in the rhythm whilst somebody is dying from their other problem. And when that happens, the ICD can detect that and think, oh, I need to deliver a shock now. And so it will deliver a shock to the patient. The ICD firing can't stop the person dying, but it can stop them dying peacefully and comfortably. And so that's why when people start to feel that the risk of a change in the rhythm is very small compared to a risk of them getting more unwell with their condition, people will start to talk about maybe turning off the ICD. To turn off the ICD is actually very straightforward. So it doesn't actually need somebody to fiddle with the device itself at all. There's no operation involved. It's done electronically by the cardiac technicians. So it's a very, very straightforward, pain-free thing to do. Often ICDs are combined in a single device with a pacemaker. So the single device does both things. It's a pacemaker and an ICD. If the ICD is turned off, it's only the ICD that's turned off. So the pacemaker carries on working exactly as it always has. Sometimes people are fearful that if their ICD is turned off, that means that their heart's just suddenly going to stop. And that's not going to happen. So actually most ICDs that are fitted will never ever fire in the whole life that they're in the patient, because the person will never develop an abnormal rhythm and they'll never be needed. And even for people whose ICDs have fired at some point or another, that tends to happen very infrequently with long gaps between. So turning off the ICD does not suddenly change anything. It doesn't make the risk of going into a funny rhythm more. So the person themselves won't really notice anything when the ICD is turned off. It is just about preventing the risk that that ICD is going to kick in and deliver a shock when that shock is not useful to the person.